George, there's a lot of transitions happening in arthroplasty. This has been going on in the hip. It's now happening in the shoulder. A transition from a long stem to a short stem. For the people listening to this video, why should we do that? And what are the benefits of moving away from a, maybe not, this certainly the transition from a really long stem makes sense, but we're really trying to push the envelope here to go to a short stem. What's the advantage of that?
Well, that's a very controversial question, Danny. I'm going to
Sure.
answer it two phases. The first phase is explain the theory behind going
Hmm.
to shorter stems, and then the second part is I'll go into the practicality of it.
Hmm.
So starting with the theory is that the the shorter the stem is, the less stress shielding is. So it means if you have a very long stem,
Hmm.
load transmission occurs through the stem, and typically load is easier transmitted through a dense structure like metal. So load is going to go through the metal and then exit. And so
Right.
the proximal part of the humerus, which is now going to be unloaded because the metal, the implant's holding most of the load, will undergo stress shielding, so bone resorption. That's number one. The second is by going to a shorter stem, we know in our younger patients, the chance of them needing a revision is much higher.
Hmm.
So it's always, in general terms, it's easier to revise something that's smaller
Sure.
as opposed to something that's bigger. The other thing is there's some literature out there that says, there's slightly lower surgical times if you use a stemless versus a stem, um, less morbidity, less engagement or invasiveness of reaming the canal. So there's several small kind of soft advantages, which I'm not completely certain that they're kind of borne out in the literature. So certainly
Hmm.
those are the advantages, and I'm sure there's some more that I'm missing.